We'll begin with Premier offering some words and then followed by Dr. Hanley and Premier again to close, and then we'll move to questions from the media. Thank you.
Thank you, Sunny. Thank you, everybody. Oh, pretty hot. Thank you, everybody, for joining Dr. Hanley and myself today. I will provide some updated information for Yukoners. I will once again remind people that we are updating yukon.ca with all of the information as it's readily available. Please continue to use that website as a source for information. I would like to begin today by sending my thoughts to all Yukoners who are grappling with this ever-changing state of our territory. I know that we are all managing in different ways, and we are all working very, very hard on your behalf, and we are all in this together. Today, our government has invoked the Civil Measures Emergency Act and declared a state of emergency. Invoking this act makes it possible for the government to more quickly serve Yukoners as this pandemic evolves. Let me be very clear. This does not indicate an increased level of risk in our territory. Rather, it prepares the government for what the needs will be in the days and weeks ahead. It gives the government a wide range of options to manage public enforcement and legal issues that may come as a result of COVID-19 virus and the impacts that it may have on our territory. The Civil Emergency Measures Act is deliberately structured to provide the power to act in a fluid and uncertain emergency. Essentially, the government will be empowered to do all things considered advisable for the purpose of dealing with the emergency. Now, these measures are basically what we can do is we can use these measures to protect the people and the properties, maintain clear and control the use of roads and streets. We can obtain and distribute and accommodate food, clothing, and other services. We can provide and maintain water supplies, electrical power, and sewage disposal, assist in law enforcement. It helps in the use of government to take the necessary measures to prevent forest fires, protect the health and safety and welfare of Yukoners, and to put in place any civil emergency plan. The government must follow very defined legislation and processes to make changes such as these. By enacting the Civil Emergencies Measure Act, we can move much faster if needed. This declaration is for 90 days, but can be terminated earlier if that is needed or appropriate. Yukoners, please know that this measure should not cause you any alarm. The current situation in Yukon is being well managed by the Emergency Coordination Team, our medical system, and by the Chief Medical Officer of Health. Today's declaration does not supersede Yukon's human rights, nor does it allow government to access your personal medical information. This is a legal tool to make sure if major government action is needed, we are prepared to take that action quickly. People have also been asking about penalties and enforcement. We see that as a last resort, but it should be made clear that by declaring a public health emergency earlier, which was done several days ago, the government does already have that authority. The Chief Medical Officer has given an order on specific issues, and he does have the authority to report offenses. Yukoners, you must take the direction of Dr. Hanley seriously. You must self-isolate after returning from travel outside of the territory, and you must not gather in groups more than 10 people. I have confidence in every Yukoner that you are going to do what's right. If you can't, then you need to ask for help. If you are able, please help those who are in need. Do it for your family. Do it for your friends, for your neighbors, and for those who are most vulnerable. Thank you very much. I will now pass things over to Dr. Hanley who will provide you some important updates on the current situation.
Thank you, Premier. Are you hearing me well? It's hard. Okay, I can't hear. Okay, now I can hear myself. Okay. Good afternoon, everyone, and bonjour à tous. I want to open with some words of gratitude. I'm grateful to all Yukoners and Yukon businesses for doing what they have been doing to help stop the spread. And together, we've done a great deal to prepare for the pandemic. I'm seeing people keep a safe space from each other. I'm seeing hand washing. I'm seeing bows and distant greetings. And I'm seeing Yukoners delivering groceries and care packages to others who are in self-isolation. We're showing again and again that we're a great and thriving community. Our focus now as a territory should be in strengthening and reinforcing the preparations and changes of behavior that we have made so far. We should behave as if COVID-19 is already circulating widely in our community. It isn't, but we should behave as it is. I'm going to say a few words in French. And when I say something in French, it'll be a short repetition of what I've been saying in English. Je suis reconnaissant à tous les Yukonais et aux entreprises du Yukon d'avoir fait ce qu'elles peuvent pour aider, pour stopper la propagation. Ensemble, nous avons fait beaucoup pour nous préparer. Et notre objectif maintenant devrait être de renforcer des préparatifs et des changements de comportement que nous avons faits jusqu'à présent. To update our case count, we have one new case to announce, which brings us to 4 positive COVID cases in Yukon. Case 4 is an individual from Whitehorse who is a close contact of a known case. Test results were received within 3 days. The person had mild symptoms and is continuing self-isolation at home. The case was not unexpected, and with ongoing investigations, we may uncover more positive tests related to these investigations over the next few days. In other words, known contacts of known cases. To be clear, it's possible that by Monday there will be more cases identified. On annonce ici un 4e cas. Ceci concerne un individuel ou individuel qui est de Whitehorse, qui avait des symptômes légers et qui continue de s'isoler à la maison. Ce cas n'était pas inattendu et avec les enquêtes encore, nous pouvons découvrir des tests plus positifs, plus de tests positifs liés à ces enquêtes. For the rest of today's briefing, I'd like to explain to you where we are in the epidemic, and I'll talk about some updates and prevention measures and clarify what I'm recommending for which situation. Some of this will be to review, but to my mind, there's no harm in repeating some of the most important messages. A long time ago, Dr. Elliott and I spoke about the 3 C steps in managing COVID: containment, cluster identification, and detecting community spread. We've moved now from identification of the first case to managing clusters. I'll explain how we're doing that. In cluster identification and management, the goal, though, is still containment in order to prevent community transmission occurring from these clusters. A cluster is a group of related cases. A person is found to be COVID positive. Close contacts of that person then may become infected. Cluster management means getting on top of that transmission cycle and stopping it. This follows a methodical process: case detection, identify significant contacts of a case, determine risk of COVID infection depending on the closeness and duration of contact. According to the risk, contacts are then advised to either self-monitor or self-isolate, and we take a very conservative approach to determining risk. Anyone who develops symptoms is tested, and then we trace the contacts of any positive cases resulting from that. And so we keep going until all contacts or contacts of contacts and so on have been identified. And that's the stage we're in now. Investigation and management of clusters, and as long as these clusters are contained, our containment strategy continues. Despite continued high rates of testing, we still have no signals of community spread of COVID, but we continue to look. That's good. When we identify a case that we cannot trace back to a known case, that signals that we may have spread of COVID within the community. That's another step in the epidemic. But the more we can delay, dampen, decrease community transmission of COVID, the better. And it's due to the imminent threat of community transmission in Yukon that our social spacing and adherence to all the other measures that we have announced in recent days is so critical at this time. With all the measures we have put in place, we're still ahead of the curve, and we all want to keep one step ahead. When we say self-isolation, there is no discretionary element, except when applied to essential workers based on individual risk assessment. Self-isolation, whether for returning travelers or for those required to self-isolate as part of an investigation, is not optional, it's an order. Self-monitoring for those required or advised to do so is not a free ride either. It means vigilant watch for fever, cough, shortness of breath for 14 days, phoning 811 if symptoms of concern develop. For healthcare providers advised to self-monitor while in healthcare settings, self-monitoring also involves use of masks and careful hand washing. Monitor yourself for the monitoring yourself is looking for symptoms, cough, fever, or shortness of breath in either case. And reporting when those symptoms develop. The more I think and read about COVID, the more I think of this as a war, and the conditions that we're living in as being close to wartime measures. How fortunate then that we're not killing each other, but working together against a common enemy. To win, just as for any war, we need to be very deliberate with our strategy. We need to be tactical, organized, and one step ahead of the invisible enemy. We are the soldiers, and we are the home guard. And whatever our role in the community, citizens, chiefs, elders, leaders, doctors, nurses, healthcare providers, support staff, business owners, employers, employees, union members, parents, and children, we'll do this together. If there's one thing that we're getting more clarity on every day, it's that social spacing, social isolation, and other measures really work. They won't stop this virus from coming in, but they'll certainly limit its spread and save lives, potentially hundreds of lives. We've all seen the devastation in China, in Italy, in Spain, and New York. Worse outbreaks are likely still to come. But here in Yukon, we will flatten the curve by doing the right thing. Now, let me review a few of the key areas that we announced 5 days ago so I can be clear. As regarding non-essential travel outside of territory and into rural Yukon, so that's travel within territory, I said I strongly advise the suspension of all non-essential travel. And let me be clear, because because of the changes occurring on different days. So when I'm talking about travel within Yukon, this is not an order, it's a consideration. It's advice as a consideration. And it means that for those who are traveling within Yukon, especially to our communities, that they consider other means other than travel. So this is a consideration. a strong advice to reconsider whether that visit is really necessary, or whether there are other means. As far as Yukoners returning home and visitors to the territory, when I said that you are required to self-isolate for 14 days, that, however, is an order. Donc, tous les Yukonais qui rentrent chez eux, tous les visiteurs du territoire doivent s'isoler pendant 14 jours. Et ceci est une commande. And again, if you cannot self-isolate safely at home, there is information and advice available through the COVID-19 info email. As far as the orders for restaurants to phase out to takeout and delivery, the bars to close, those were orders, as was the order to close all personal service establishments by end of day, March 25th. I want to reiterate that I'm confident we're in a good position. Our measures have been ramping up over the last 2 weeks, and especially in the last week. We're well placed for further cases, and this is time to reinforce and support what we already have in place. Communications, financial support, community support, healthcare preparation continues, and you'll see that more visible over the coming days. Although next steps are being contemplated and scenarios worked out, I have no immediate plans to clamp down further. We just need to catch up with where we are now and tighten the loose ends. I know there are many, and many clarifications and operational details will still come. Around the country, we're all in that position by virtue of having to set new norms and then catch up with them. But rather than going further than we are now, we just need to do better with what we're currently supposed to be doing. For the business community and worried retail owners, I know you're facing incredible stress and hardship. I know that supports will be coming, whether financial relief, information, or other needed help. It's also a very good time to look at other interim business and service models and innovations that will help you to get through these difficult times and still offer much needed services to the community. In view of today's announcement of invoking the Civil Emergency Measures Act, I want to reiterate that this is not a signal of worsening spread, but it does allow for more of the support and enforcement mechanisms to be applied more rapidly and with less red tape. It's a welcome complement, in my mind, to the public health emergency that we declared prior to our first case of COVID arriving in the territory. In yesterday's New York Times is a piece by David Brooks that I advise. I almost want to say order you all to read. It's called Coronavirus, the Moral Meaning of This Plague. Keeping in mind that he's writing from one of the current epicenters of COVID, the following words particularly struck me. We're all assigned the task of confronting our own fear, but gradually you will discover that you have the resources to cope as you fight the fear with conversation and direct action. A stronger self emerges out of the death throes of the anxiety. Now is our opportunity to examine our collective self and to emerge all the stronger. And on that note, I will open the floor for questions.
Before that, I'll just thank
Sorry,
you very much. Thanks, Dr. Hanley. Thank you very much. I just want to make some conclusion marks just to wrap everything up here before questions and answers. I do want to reiterate what Dr. Hanley said and make it clear that this declaration of the state of emergency should not create panic. It's preparation. The situation has not changed. Just our ability to respond to an ever-evolving situation has. We now have more tools in the toolbox. As governments, we can carefully measure to ensure that when action is taken, it follows all appropriate guidelines, regulations, and processes. These measures are extremely important, but can also be lengthy and complicated and complex. So as we see rapid changing, now is the need for us to be able to respond as quickly as possible, and that is the statement for today and the measures discussed here today. We do know that these are very difficult times for people. This past week, we have seen many actions taken to support individuals and to support businesses, both federally and here at home. But that does not reduce the anxiety that I know that we are all feeling. I want everybody to take some time away from the news, if they can, this weekend. Read a book, call a friend, or take a walk outside at safe distances. I'm reflecting on how lucky we are to live where we do live, in this beautiful place that we do call home. I'd like to thank the medical community and the emergency coordination team for their selfless dedication to keeping all of us safe and healthy. I know how hard you are all working at this time, and we very, very much appreciate your actions. And again, please, if you're not well, please stay home. I cannot repeat this enough. This is our best and only current way of stopping the spread of this virus. It's on every Yukoner to do so. Keep up the good work on social and physical distancing. I echo Dr. Hanley's comments as far as what we've been noticing. Lots of great measures out there. Provinces who are ahead of us in this pandemic are reporting that these efforts have had positive effects. If you need help, please reach out. We have supports in place for people who are struggling throughout this time. Yukoner's strength is in our sense of community. This strength will get us through this unprecedented time. So please stay safe, stay kind, and we'll open up to any questions that you have at this time.
We'll go to those in the room, and then we'll go to the phone.
Just go up to the mic.
Yeah, please come to the mic. Sorry.
Do you want to go first, Gord? Hi, Tim Kacharik, CKRW. Just can you expand on the release issued last night, just in regards to the case 3 and the 2 particular places that you had issued the warning for? So did this 4th case come from those 2, or can you just dive into a little bit more detail since it's your first public opportunity to speak to that?
Sure. So one of the more recent cases did have exposure in those places, posted Bethany Church and Elias Dental in Whitehorse. And so part of that investigation, the case investigation, is looking for significant contacts, including, as I said before, like close household contacts, and those are in general the higher risk contacts. And then looking for individual contacts, and then places of concern types of contacts. And so that might include, for instance, airplanes or conferences and conventions, or group settings, or clinic environments. So those are the types of cases that often will come up. So I would say, first of all, expect more of these when investigations are around cases, that there will be certain settings that are deemed to be at some risk, albeit low, for someone to be exposed. So low risk, because generally these tend to be more transient, like there's not a lot of time spent in these areas, and that's part of the risk assessment. So it's time and the particular setting involved. So these are like precautionary measures, and just to kind of widen the net and look for any possible exposures. So these individuals are, because the risk is present but low, these are individuals that are asked, if you were in that place at that time, just keep a careful eye for symptoms, and if symptoms develop, then report. But it does not mean that those individuals have to self-isolate.
We'll go to the phone now. We'll start with Radio Canada.
Oui, on peut faire en français?
Oui.
J'aimerais savoir maintenant que cette mesure est en place, est-ce que vous allez changer d'avis par rapport aux frontières? Est-ce que ce serait la prochaine étape? Et si ce n'est pas le cas, quelle est la prochaine étape?
The question was whether we're contemplating border restrictions as our next step. La question c'était pour si on est en train de contempler si la prochaine étape est des mesures sur les frontières. Et je veux dire que on est en train d'examiner les prochaines étapes, mais on n'a pas l'intention à ce moment de faire plus loin qu'on est à ce moment. Oui, c'est une possibilité, mais c'est plus important d'être préparé avec toutes les mesures qu'il faut avoir si on fait une mesure comme ça. Donc, c'est une possibilité comme tout. Mais on est juste en train de faire toutes les prochaines étapes possibles. Mais pour le moment, j'ai pas l'intention d'aller plus loin. I was just saying that I'm not contemplating border measures at the moment. And again, this is a time, I think, to reinforce where we are already. But at the same time, we're looking at all of these possibilities of what should trigger an action at which point. So we're doing that scenario planning at the same time that we're trying to strengthen what we're already doing.
All right, we'll go to Steve Silva from CBC.
Hey, can you hear me okay?
Yes.
Or can you hear me okay?
Yes. Go ahead, Steve.
Okay, well, I'm not hearing anything, but you can hear me okay, right?
Yes, Steve, they can hear you.
Okay, so I guess I have a couple of questions. One would be for Mr. Silver and one would be for Mr. Hanley. For Mr. Silver, apologies, I think all my a few times and I've been able to hear everything at the beginning, so if you were repeating this, I apologize. What specific measures or powers can you now use with this state of emergency being declared, and which specific measures or powers you are typically having to use? And as for Mr. Hanley, who are the people considered to be essential workers in Yukon's healthcare system, and are they exempted from travel advisories or restrictions in any way? For example, people who are supposed to travel into Yukon are supposed to self-isolate and not go to work if they arrive in Yukon recently. Is that still applicable to those essential workers in the healthcare system?
So the Civil Emergency Measures Act is designed so that the government can act swiftly and efficiently in an emergency situation to protect people and property and ensure basic services. Essentially, the government would be empowered primarily through the Ministry of Community Services, Minister Stryker's department, to do, and I'll quote directly from the Measures Act, quote, to do all things considered advisable for the purpose of dealing with the emergency, end quote. So that is including but not limiting protecting people, protecting property, maintaining, clearing, and controlling the use of roads and streets, using and obtaining and distributing, accommodating food, clothing, or other welfare services, provide and maintain water supplies, electrical power and sewage disposal, assist in law enforcement, fighting fires, preventing fires, protecting health, safety, and well-being of local inhabitants. So again, all of these measures are now able and in place, but again, we are not increasing the risk consideration today. We are just making sure, as Dr. Hanley speaks of, in the future, the risk of community spread is something that we have to be prepared for, even though it's not happening now. And so this Emergency Act, this Civil Emergency Measure Act, gives us the ability and the authority to do so.
Steve, the second question was about essential workers, and then kind of a sub-question about healthcare workers, I think. So as I believe the kind of the official list of essential workers is being developed and should be finalized shortly. But really, it's the people that are required as first responders, maintaining critical infrastructure, and healthcare workers. So for healthcare workers, there is an arrangement, a risk assessment arrangement that is occurring to individualize the recommendation based on an equation of how essential is that healthcare worker, and then what is the advice that corresponds to how important it is for that person to be working at that point. So an example might be a specialist who needs a break and needs to rest, because preservation of workforce is a critical part of maintaining us through a pandemic. We have to think not just about this week or next week, but the months ahead. So in that case, for instance, a specialist who travels in to replace another to carry on with critical work will be risk assessed, and if assessed to continue to work, will work while under vigilant self-monitoring, which in the healthcare setting includes appropriate use of personal protective equipment, meaning in addition to what would usually be required in that environment, a mask at all times. And that is in the case should symptoms begin to develop, that the mask is already in place.
All right, we'll go to the Whitehorse Star.
Hi, I had a question for Dr. Hanley. Two-part question, really. When you're talking about contact tracing, you mentioned time and setting are part of risk assessment, and I'm wondering what other factors are considered when assessing risk. And my second question is, how much is asymptomatic transmission a concern when telling people to self-monitor but not self-isolate?
I'm going to answer the second question first, because I know it's a burning and evolving question. And although there is increasing literature and helpful literature on asymptomatic, the answer still is not clear on what role that plays. I think one thing we can probably fairly safely say is that the more intense the epidemic, the more intense the burden of COVID in the community, the more significant that asymptomatic transmission probably is. And that in normal, in sort of pre-pandemic levels like we are, or pre-epidemic areas, because asymptomatic transmission is, if anything, a minor contribution in a low burden presence like we are now, the role then becomes less and less significant. So the huge part of transmission of COVID, particularly at this point, is through asymptomatic, and therefore the justification for self-monitoring with careful symptom review as an effective way to, and a safe way for those lower risk. Whereas for the higher risk contacts, and to answer your first question, that depends on how close was the contact and how long was the contact. And if you really wanted to know the details, the exact guide that we use, which is based on Public Health Agency of Canada guidelines, is actually available on the health professionals section of the COVID-19 website. And in that section, we put all of our provider updates, our public health guide, how contact tracing is done, what instructions are given to the patients, etc.
All right, we'll go to Laurent Boreal as our last phone question.
Oui, merci. Dans le communiqué, vous mentionnez que les Yukonais sont encouragés à se comporter comme si le virus est déjà dans la communauté. Est-ce que ça implique de rester le plus possible en isolement, même si on n'a pas de symptômes, même si on n'est pas malade?
Je ne sais pas si j'ai bien compris. Il s'agit de l'auto-isolation, l'application.
In the press release, you said that the Yukoners are urged to behave as if COVID-19 is already in the community. So does that mean that people should self-isolate as much as possible? Is that what you encourage?
That's not what I'm encouraging. I'm encouraging what we call social distancing or social spacing, so that those, but not self-isolation unless in those particular circumstances where we are ordering self-isolation. So it's a great question. I'll answer in French as well. But the question really is whether, because we say behave as if COVID is already present, does that mean we should be really staying in our houses? And that's not the case, except for those circumstances where we are specifically ordering self-isolation, the return travelers or people who are identified as contacts and then required to self-isolate as part of that contact investigation. So the point, though, is that if there is undetected spread of COVID in the community, that the measures that we have in place with social distancing, with social spacing, will prevent the transmission of COVID, diminish the spread of COVID in the community. So that's why it's useful to think of this as if it's already present. How would I behave if a person close to me had COVID and I was less than 2 meters, then that puts me at risk for transmission of infection. Donc c'est important d'emphasiser que c'est d'imaginer la présence de COVID dans le territoire, qui circule dans le territoire. C'est un moyen de renforcer l'importance de maintenir les distances sociales. Mais c'est pas pour demander aux gens de isoler dans la maison, sauf pour les gens qui sont ordonnés de rester dans la maison sous les mesures commandées dans les situations d'investigation des cas ou pour les voyageurs.
And I'll just add to that a bit. Put yourself into the perspective of a Yukoner. So in my perspective, I'm not traveling across a border, so I'm not being directed to self-isolate. However, I am doing everything in my ability to stay at home as much as possible, work from home as much as possible, and to self-isolate or to monitor my distances amongst the other people when I am in public. Now, on the other side, if you are crossing a border and if you're coming into the Yukon, going to gas stations is not self-isolating. Going to grocery stores is not self-isolating. Self-isolating is when you get here, having a place where you are by yourself. That's self-isolating. So we are urging again people that are getting here to self-isolate immediately, and the government can help in that pursuit. Information is available on yukon.ca if you're just getting to the Yukon. The message should be very friendly as well. Yukoners coming home, welcome home. Make sure that you know what you're supposed to do. Everybody's counting on you to do your self-isolating, and everybody's counting on each other to make sure that the communities are made whole, but at the same time, we're still acting community focused, but at the same time, we're doing everything we possibly can to distance ourselves.
Again, Tim from CKRW. People are looking at the situation in BC. Obviously, they're our neighbors, and they've had some issues with long-term care facilities. I got a call today from a concerned resident wondering what's happening with the long-term care facilities here. They said that when there's not really restrictions. I know you had said earlier about limiting visitors, but even with healthcare workers going in, some of those rules weren't being enforced, that there was also a lack of PPEs, personal protective equipment, in those facilities for workers. And I'm also seeing and hearing that, healthcare workers coming back to the territory, and I know we've covered this before, that they're being now mandated that they have to go back to work without any self-isolation for 14 days. So I get that they're, obviously important right now, but if the Prime Minister can self-isolate for 14 days, why can't healthcare workers as well? Because this was the concern of the person I talked to today, saying that, yes, healthcare workers want to help and go into long-term care facilities, but yet they're still pose the same risk of going in. Can you address that? Do we have enough PPEs in those facilities? Can you speak to what type of restrictions are taking place at the continuing care facilities?
Absolutely. And as in many cases over the last few days, the first thing I'd like to say is you need to be very, very cautious about what other people are reporting or witnessing, because I've certainly, although sometimes there might be a useful comment or a useful piece of advice, often these are not, frankly, not grounded in truth at all. So the continuing care has actually been well ahead of the game with the measures that they put in place, including what appeared to be at the time the early restriction of all visitors except for essential reasons. And I think they've proven just to be applying the caution needed to protect our elders and our vulnerable. Within the facility, appropriate use of PPE is most definitely being adhered to. And although PPE is an ongoing, very important issue for supplies, projections, as a whole system, to making sure that we have adequate inventory, not just for now, but for a surge for the future, it's definitely an important question, but we're also confident in our PPE supplies for now and for the time being. And that includes all facilities. So as far as workers, I'll go back to what I explained before, and that's with risk assessments are applied. Healthcare workers are essential workers, but where they can be replaced and stay in self-isolation, that is still the preferred approach. Where there is no practical replacement, and that means maintaining rotation and continuity of staff, being able to give adequate rest so that healthcare workers can stay as a strong workforce, which is, again, critical. Then healthcare workers, including physicians and nurses and other frontline providers who would otherwise be in self-isolation, are allowed to work under a rigid and vigilant self-monitoring program, which includes use of PPE over and above the usual requirements.
We'll take one more from the room, and then we'll close off. Thank you.
Gord Fortin, Yukon News. Questions for Premier Silver. You had mentioned the act that was just invoked would be in place for 90 days. I was wondering if you could touch on what would happen after that 90 days expires.
So again, we're doing the necessary work right now to make sure we are prepared for that 90 days. The act would be able to be reconvened as well if we wanted to extend it. So we have the ability to curtail it if necessary, hopefully, but we also have the ability to extend it at that time. Thank you, everybody. Appreciate your time today. Thank you.